As we have said, different techniques have been used to vascularize microtissues, but what are the most appropriate techniques for each solid organ? Neurospheroids and cerebral organoids obtained from neural stem cells and induced pluripotent stem cells are useful to study brain pathologies and are of special interest for drug screening. However, the main challenges include the recapitulation of brain processes, such as vascularization. A possible solution is to produce a perfusible and functional brain model through the co-culture with endothelial cells. Alveolar chips incorporating endothelial and epithelial cells on a stretched substrate is one of the most advanced alveolar models. Inflammatory responses at toxicology studies have been satisfactory compared to responses in ex vivo mouse models. Morphology of endothelial channels is one of the main problems in the chip, as they are much larger than capillaries in vivo, influencing adhesion of cells, shear stress, flow velocity, and nanoparticle distribution. A possible solution would be a bronchial epithelial chip. Regarding bone, a matrix incorporating calcium phosphate is needed for rigidity and simulation of mechanical strength. 3D bioprinting technology using polylactic acid and hydrogel has been used to create a large vessel. In the future, should be combined with vasculogenesis of endothelial cells. 3D and 2D cardiomyocyte tissues have been used guaranteeing contractility. Cardiac tissue created on hanging drop cultures and biodegradable scaffolds support endon release with a crucial cardioprotective role. However, neither of these models contain a perfusable vasculature, so what can we do? An approach is the culture of cardiac myocytes on top of a perfusable capillary bed. Future challenges could include the combination of this technique with 3D bioprinting. A liver spheroid created by the hanging drop method resulted in the formation of a pervascularized spheroid. The layer-by-layer fabrication method were able to connect to the host vasculature, and the aggregation of many spheroids within the endothelial cells demonstrate perfusion of the culture medium. The co-culture of different cells in matrigel yields to aggregation due to contractive forces and became a pervascularized liver pad. Future challenges include vascularization and build-up genesis of hepatic spheroids and organoids. 3D skeletal muscle models are formed by suspending myoblasts. Next generation could also incorporate neuromuscular junctions by adding a motor neuron spheroid. Lack of functional perfusable vasculature in these models limits the size and density of engineered skeletal muscle tissues. Prevascularized in vitro tissues become vascularized by the host. However, they are still tedious and uncontrolled. A fully vascularized skeletal muscle tissue has not yet been engineered. A combination of 3D bioprinting, molding techniques, and vascular beds could be the solution. Main objective regarding tumors is to represent the microenvironment, as the proximity to the vasculature influences the expression of target proteins in the tumor, affecting drug delivery and drug response. Tumor cells suspended in a 3D extracellular matrix have been cultured, surrounded by perfusable human cell-based vasculature. An optimization of the platform is required to characterize the 3D architecture and associated effects, as well as the signaling of vascular cells and influential drug delivery. The use of patient-derived induced pluripotent stem cells will personalize platform for therapeutic screening. So now that we have discussed the different techniques for vascularization, the question is, what have we done so far? And more importantly, how future looks like?